Our new policy is intended to support career development and meaningful employment for all of our clients. And it's critical that we recognize that even with all the best strategies and the supports aimed at the person, we can never lose sight of the fact that success will only be achieved if there's a commitment from Maine employers who understand that persons with disabilities, persons who are at risk, persons who are elderly, are an untapped resource. Specifically, we have something called Working Together, Expanding Maine's Workforce, which is an organization that has 45 businesses as its partners. The list has grown over the years, and each business has signed a pledge to further the employment of persons with disabilities. It was both important and exciting to recognize several of these businesses for their efforts in increasing the employment of persons with disabilities recently. In 2008, Bates College and Hannaford's were recognized, and in 2009, Kohl's in Biddeford and Aroostook Center Mall in Aroostook County. And there is one large employer that also needs recognition, and that is the state of Maine. Several years ago, Governor Baldacci signed an executive order which directed state government to be a model employer for workers with disabilities. We've come a long way, but the work must continue. And I know there are probably some of you in this room, because I've known many of you and some of the things you've been concerned about over the years, who say the state of Maine is not a model employer, and simply because we do not present the data of people who are disabled working in our workforce. There are many reasons for that, but I can assure you that at least in the state agencies that both Commissioner Fortman and I represent, there are people with disabilities who come to work every day, some with more severe challenges than others, and they get supported by those of us who are their co-workers. DHHS has also received the Choices CEO Medicaid Infrastructure Grant since 2000, and we were a national leader in creating state-level policies in the Medicaid buy-in program. We partner with the Muskie School to direct this grant, and we have been joined in recent years by the Department of Labor, the Commission on Disability and Employment, and the Maine Jobs Council. It seems like only yesterday, but it was really 5 years ago, when Maine was awarded the Comprehensive Medicaid Infrastructure Grant for data collection, analysis, and strategic planning. Ongoing efforts from this include better outreach to employers, establishing Maine state government as a model employer, greater support for young people with disabilities who are transitioning from school to work, improving vocational rehabilitation services, and expanding benefits counseling to people with disabilities who work or want to work, and enhancing data collection and sharing, particularly now when it is critical to the public policy debate. Lastly, also focused on improving the work incentives for people with disabilities who receive benefits, especially the Maine Care option for workers with disabilities. Let me now talk about some specific DHHS services and supports that are in place today to help people whom we serve find and keep employment. It all begins with the Maine Care program, where the funding for certain of these supports are found. It goes back to 1999. Many of you can probably remember that time period along with me, when the Maine Care Workers with Disabilities option was established. Back then, we thought maybe 200 people would want to take advantage of that. And today, I'm happy to report that 805 people have exercised their option to be part of the Maine Care Workers with Options program. This option offers full Maine Care benefits. It's coverage for people with disabilities who would otherwise be eligible for Maine Care if they didn't have earned income. This provides opportunity for people with disabilities who go to work to receive health coverage if not available at or through their employer. And not unlike many of the opportunities in the new Affordable Care Act, this benefit will likely come under some scrutiny as the public policy debate of who should have access to Medicaid takes place in the next administration. There are many successful programs within the Medicaid program that have been effectively utilized, some by the Office of Adults with Cognitive and Physical Disability Services. Say that 10 times. The comprehensive waiver, known as Section 21, and the supports waiver, known as Section 29, allow for supported employment that includes assistance from an employment specialist or a direct work support to help a person plan, develop, and keep a job. Many of you probably don't remember when Ron Welch was president of the National Association of Mental Retardation Directors, and he testified before then Senator George Mitchell's Finance Committee in Congress. His testimony was to advocate for supported employment as an allowable waiver service under CMS rules, and they were successful. Thank you, Ron. These efforts are coordinated with the Division of Vocational Rehabilitation in the Department of Labor, which has been an important partner in our work. I'd like to take a moment to pause for a commercial break. There's a few commercial breaks in my presentation. I didn't write that part. Later today, you'll have a chance to attend a workshop that discusses the changes in Section 21 and 29 since July and the agreements between vocational rehabilitation and the Office of Adults with Cognitive and Physical Disability Services. For those of you who are primarily focused on serving that population, I hope that you'll attend that workshop. Now moving on to adult mental health services. Vocational services provide information and support to individuals with mental illness who want to work in their community. Work is often a way to re-enter the community and a vital contributor to mental health recovery. Nothing you don't already know because you're here. The Work Incentives Planning Assistance Services help mental health consumers by reviewing potential employment earnings and how current benefits could be affected. In addition, 7 employment specialists are available across the state to help mental health service consumers get and keep jobs and improve their job-related skills. Finally, the long-term vocational support program provides varying support, which might include job coaching, resolving conflict, and communicating with coworkers and supervisors. Results of these efforts show that these supports are a key component in recovery, and we must never lose sight that they are cost-effective. Remember those words, they'll be critical in the next 3-4 years. The Department Community Mental Health Program conducted a 10-year follow-up study of clients with co-occurring severe mental illness and substance abuse disorders. They found an annual savings of more than $16,000 per client in mental health treatment costs for those who held a steady job when compared to those who weren't employed. Now to my next commercial. This afternoon, Ron Welch and Chris Robinson from the Office of Adult Mental Health will speak about the Community Integration Workers Roles, the CSWs, while the Office of Maine Care Services, Tony Marple and Patty Dushuttle, will address medical necessity and what is allowable under Section 17 as it relates to services and skills development. I have been a long advocate that CSWs, community integration workers, whatever label you happen to have when you do the work, should have a focus on the employment discussion with clients. And I think this policy, this discussion is an attempt to help you understand what is allowable as a service under the Medicaid program. I hope your focus won't be on what's billable, but rather what is needed by the client, and therefore then billable. It's an important distinction.